So my name is Jason Goodrum. I'm an orthopedic surgeon here in Kerrville. I went to medical school at University of Texas, medical branch in Galveston. I was born and raised in Nacogdoches, Texas, Northeast Texas, almost to Louisiana. I did my undergraduate training in North Carolina at Appalachian State University, and then transferred to Ouachita Baptist in Arkadelphia, Arkansas, and then medical school in Galveston. And then ended up in University of Texas Health Science Center in San Antonio for residency. Did a brief year for sports medicine in California, South Lake Tahoe, California, and then was quickly back to Texas after that 1 year. And my wife and I moved here last September. I mean, lots of things. Number one, the rolling hills is awesome. The deer around the area, you see them everywhere. More importantly, I think the people, it's the culture for some reason, just attract really nice people. The patients are great. The staff has been great. So it's a great place to raise a family. And so it kind of drew us here from the get-go. I did most of my, like I said, did my training in San Antonio. So we would come up here all the time, and we was like, why don't we just move here? So that kind of led us here. So I like to hang out with my wife and my son. We have a 15-month-old baby boy, I guess toddler setting. But we like to play golf, we like to hang out, we like to drive the golf cart around. So family man when I'm after hours. And yeah, like to hunt and fish as well. I'm trying to get into golf, not very good at it, but just started playing. I chose orthopedics for a few different reasons. I think, God kind of destines us for certain things, and I think part of that is the way you're raised. My dad had a drill in my hand since I was able to walk. I don't know whether he just wanted free labor or whether he was trying to train me, probably the training part. And so, that accompanied with, I've always enjoyed physics, mechanics of how things work. I enjoy learning about new things, and so that kind of drew me into medicine. And then with using the Makita drills and things like that, along with the physics passion, kind of led me down the orthopedics trail. So some of the best things I do in my field, I would say I like to keep people moving. And so I think movement is key to life. So whether they're young or old, young people usually heal very well, but usually it's a sports injury. So we try to get them back as quickly as possible at the level where they were before. So that means ACL reconstructions, that means rotator cuff repairs, instability of the shoulder, meniscus repairs, cartilage restoration, things like that. As we age, we want to keep moving, and we are staying very active as a population. So my job is to keep people moving, and so that's joint replacements, that's shoulders, hips, and knees primarily for joint replacements. And then after that, I love trauma. I come from a very heavy trauma institution in San Antonio at University Hospital. So I love getting people back to their normal state quickly as possible, fracture care, things like that. I love Peterson Health for a few different reasons. As I said before, the people are just amazing in the Hill Country, so I think that draws people in, and then especially to Peterson. So I don't know how this started, but just everyone I talked to were just super nice, willing to help people. They're always patient-driven, oriented. They want the best thing, regardless of cost or regardless of difficulty or whatever the thing may be, whether it's a social issue or whatever. Everyone's willing to jump through hoops to help each other, which is rare, I think, in medicine these days. So that's number one. I think also Peterson has a tremendous forward-thinking attitude. So yes, it might be rural hill country, but they're always on the latest, greatest in terms of technology, the newest way to do things. They'd stay on top of the latest in healthcare. So all those things kind of drew me here.